Hi, everybody. Welcome to week 7. It's hard to believe that we're here already. Let's get going with this week's announcements. So, first, some just kind of general information for both groups. We are approaching week 8. There are many skill evals that are due week 8. In my video next week, I'll detail those for you. But just as a heads up, you may be asked to be completing more skill evaluations over the next 2 weeks. All right, so information first specific to Clinic 1. In my conversations with students this week, these are some things that I would like to share. So first, for skill evaluations, a reminder that if a student asks you to do a skill eval, you can find information on that evaluation in a couple of places. So in the clinic manual, which has the purple cover that is printed and in the faculty office, it tells you whether something is a process or a product. Remember, if it is a process skill evaluation, like for probing, you're just watching how they probe, the angulation, things like that. You're not actually checking the numbers. Same for hard tissue chart. You're checking that they're using a 1723 Explorer, they're using air, light, etc. And you're just watching the process of the hard tissue charting. You're not checking the product at that point. That gets checked with the DDS exam and filled out on the patient tracker. So you can find in the clinic manual whether these are process or product skill evals. You can also find in that manual who can complete these. So whether it's an RDH or a DDS who's able to fill it out and observe the form and observe the student during the evaluation. And if you want to look at the evaluation itself, if you look in the program competency and skill evaluation manual, that is on the desktop of every computer in the dental ops file. That will show you the entire skill eval if you'd like to see it. If you just want that snippet as to what the student needs to be doing for that, like a sexton or 4 teeth or whatever, you can find that in the clinic manual with the purple cover. A note on Blue Note. So as far as the 15-minute warning goes. So I'm going to use the example of an evening clinic. The 15-minute warning goes off at 7:45. What that means is that students can't sign up to have anything checked after 7:45. However, their patient can be in the clinic until 8, and they still have access to the faculty coming into their room and doing things until 8 p.m. So let's say the student signed up at 7:44 to have a scale check. You can check that all the way up until 8 p.m. If it's a skill eval and they had signed up before the deadline, as long as you can get it done before 8, you can do it. So that is still considered working time until 8 p.m. Now, if you don't have enough time to get through something, like let's say it's 8:10 and they had signed up for a check-in prior to the deadline and you can't complete it in 5 minutes, that's okay. You would just let them know we don't have time to complete that tonight. But otherwise, they do have access to you. You have access to the patients until 8 o'clock. On the patient tracker, it seems like there might be a little bit of confusion on the quality assurance. So the area that says all areas of care plan completed, that means that care plan document in Eaglesoft, they filled out every single spot on that care plan. So they didn't leave anything blank. So it's just specific to the care plan document. The acronym ES means Eaglesoft. It doesn't mean electronic signature. So when you're looking at that quality assurance, P means it's a paper form. ES means that it's an Eaglesoft form. So that might help clear up a little bit of confusion. And then one other note for how to handle the end of clinic that may be helpful. So if we're still in that same time scenario that I just gave you, and so let's say it's a night clinic, the patient has been dismissed at 8:15. The student at 8:15 is to go into their unit. They're to gather all of their paper, because paper, of course, can't be disinfected. And they should either put it on top of their unit, or sometimes they'll tuck it in a drawer or a cabinet. That gets it out of the way because our priority at 8:15 is for them to get their instruments out of the unit and to then get the unit cleaned, disinfected, and broken down. Once their unit is broken down and disinfected, then they're going to start working on their SARP and, of course, getting that process done. So if you need to access their paperwork, like you're trying to check their quality assurance, just go in the room, ask them where it's at, whether it's on top of the unit or tucked in a drawer, grab it. I usually take it to another room, so I have access to Eaglesoft and can check it without disturbing their disinfection process. So that might help things run a little bit more smoothly. For second year faculty, just a couple things for you. Reminder that at any appointment in which a patient receives local anesthesia, they must have vitals taken. And so even if it's the second appointment and their vitals were taken at the first, if they are having local done, they must have another set of vitals. Another point of confusion that I want to hopefully provide a little guidance on is the calibration check. So when a student signs up for a calibration check, and you are the person on the other side that needs to come over and calibrate, that is like a top priority. So as soon as you have left the room for wherever you're working, go do that calibration check before checking any other Blue Notes. It should only take you a couple of minutes to do that. You can let your group know, I'm going to calibrate and I'll be right back. Because the student in need of the calibration check really needs to have that done fairly quickly. They are allowed to start scaling. What I do with those students, if it's my student that I did the check-in, I'll say, you need a calibration. Go ahead and start scaling. You can start in the upper right. Do not move out of that quadrant though, until your calibration has happened. I'll be right out, just 1 second. That way the other person can come in. Again, try to get in right away. Just spend a couple of minutes in there and get that done so that the student is able to move on. The student who, after they have had their check-in, they can have the patient sign the care plan before the calibration check. That's okay because we need that signature so they can start scaling. However, if the formula did change, they would just need to list that as an alteration to care plan in the SARP. That is all I have. I know that's a lengthy video, but I do hope that some of that information will help things run more smoothly for you. If you have any other suggestions on things that you would be helpful, please reach out to me. Otherwise, have a wonderful week.